As the cost of healthcare continues to rise in America, we must work toward a solution. Historically, America's healthcare system has depended on volume-based payment models. This model encourages a high volume of service visits that include providers' visits, medical tests, emergency procedures, and pharmaceuticals. Providers are not compensated for coordinating patient care or when addressing socioeconomic issues with patients. And patients are often stuck paying for expensive quick fixes instead of efficient preventative care. Care is often reactionary, not preventative, failing to focus on overall health outcomes. As a result, Americans spend more money on healthcare each year than other developed countries without the benefit of greater life expectancy or better overall health. Spending more money doesn't make you healthier. So if we assume value equals the health outcome achieved per dollar spent, how do we increase the value of American healthcare? At Premier Health, we believe that lowering cost while delivering better quality healthcare increases value for the community. To fully understand value-based care and its benefits, we first have to examine why a healthcare system strategy based solely on volume-based care is failing. Let's look at a few examples.
I practice medicine because I want to make a difference in people's lives. But in today's volume-driven healthcare system, I find myself treating symptoms instead of preventing sickness. My patients' health and happiness are what's most important to me. But too much of my focus is on things like juggling multiple performance metrics, bundle payments, and administrative duties.
In the past year, I've spent a lot of time and money visiting various specialists and hospitals. I feel like I never see the same doctor twice. I worry that I'm just another billable visit. And all these prescriptions, I'm not sure anyone's even keeping track of my medical history. I'm tired of trying to navigate such a complex medical system. There's got to be a better way.
My employees mean the world to me. And when they're missing work and their medical bills pile up, they and their work suffer. I try to stay up to speed with the latest plans and policies so that I can offer my team the best coverage we can afford. But that's no small task. What's worse is current health insurance plans don't address the needs of my employees' well-being.
Sound familiar? Many of our problems begin with HEDIS, CAHPS, and STARS metrics, which are useful quality metrics but fail to measure true value. And payment models such as fee-for-service meet government regulations and drive volume, but also fail to drive true value. At Premier Health, we build healthier communities by implementing a system that focuses on high-value care and appropriate volume. Because our patients, providers, and employers deserve a more valuable experience. For care providers, Premier Health offers population health resources such as care advisors. Our care advisors help identify patients who need extra care, coordinate the right care for your patients, and allow you to get back to the joy of practicing medicine. Premier Health is headed by local medical professionals who share the same compassion of practicing medicine as you do. We've built a system that puts the right people in place to help you run a successful and caring practice by removing the burdens that get in the way. For patients, Premier Health's care advisors identify gaps in your care and help you make the right healthcare decisions. Our advisors empower you with the information you need to be healthy and stay healthy. As a result, you get a more personalized and coordinated healthcare experience without any unnecessary cost to you. This means your care is more aligned, cost-efficient, comprehensive, and valuable for you and your family. For HR representatives and business owners, your employees can begin to trust their healthcare plan. Premier Health puts the right information in your hands and simplifies the difficult task of educating your workforce for healthier living. And by putting programs in place which help to keep your employees in tip-top shape, your employees are more likely to be productive and focused on staying healthy. Your business is more likely to save money on lost productivity and expensive employee costs when employees are constantly sick. Value-based care provides higher quality care and health outcomes in a cost-efficient manner, because spending more doesn't mean you'll receive better care. Volume-based payment models, like fee-for-service, encourage demand for more and more services. Instead of preventing a trip to the hospital, the current model simply treats your symptoms. By implementing a system of value and offering population health resources, such as care advisors, Premier Health provides you with a more coordinated healthcare experience that is more cost-effective. Premier Health's goal of providing value-based care is simple. Through partnering with providers and educating our patients, we're building healthier, happier communities. To learn more about Premier Health's approach to value-based care, visit premierhealthgroup.com. Premier Health, value-based care. Feel better, faster.